Hi guys, it's Dr. Izzo. I want to welcome you to CWCH TV. Each couple months we're going to do a segment on different things you guys always ask me about. So right now we're going to talk about a disease state called osteoporosis. Osteoporosis is 100% preventable and it's asymptomatic, meaning that it doesn't present with any symptoms whatsoever. It's not a female disease or a male disease, it's an everyone disease. And again, it's 100% preventable. So I'm going to show you how to prevent that today. Real simply, your bone is made up of a grid. Okay, so if my fingers represent the vertical grid and the horizontal grid, it's called the trabecular pattern. Okay, so basically you want that grid to be nice and tight so your bone's strong. What happens in osteoporosis is that that grid becomes weak. And what happens is the horizontal portion of that grid starts to give way. When you get a vertical pressure, what happens? That grid collapses. So I'm going to show you now in a chart what happens, how bone is resorbed, how calcium is needed in bone to make it strong, and how we're going to prevent that from happening to you. Okay guys, so let's talk about osteoporosis and let's understand how it happens. So basically there's bone formation and resorption. So what osteoporosis is called, it's called the holy bone disease. So basically here's that tight-knit grid I showed you with my fingers, and here's what happens. It gets much more holy. So how does this happen? What happens as we get older is basically the resorption of bone happens faster than the making of bone. When we're younger, it's the opposite. The making of bone happens quicker than the resorption of bone. So you have these guys that need calcium minerals to make this bone form. How does this happen? In your intestines, okay, blood calcium is carried through the blood, gets absorbed through the intestines. So this shows a healthy intestine, and this shows how calcium is being absorbed in a healthy rate. When we get older, the same blood calcium is not absorbed at the same rate. Why does that happen? A couple things. Number one, it's because estrogen is produced at a lesser rate. Testosterone for males is produced at a lesser rate. So as we age, hydrochloric acid is produced at a lesser rate. Hydrochloric acid breaks down calcium and helps it get resorbed back into bone. Another very important part is vitamin D. We live in a climate where vitamin D is very deficient, meaning we don't have a lot of sun, so most of us are deficient in vitamin D. Vitamin D also plays an extremely important role in the absorption of calcium. So you have a couple things that are very important, coupled with risk factors. The risk factors of osteoporosis have long thought to have been you're slight in frame, you don't exercise, you're a female, you're postmenopausal, and you are basically small boned. That's what's been thought in the past. I see just as many males as females with osteoporosis, and it's again 100% preventable. So let's talk about your risk factors versus what we're going to do to supplement. Bone gets produced at the highest rate when you're 35. Once we get to menopause or andropause, what happens is we get it produced at a lesser rate. And then basically, instead of bone being produced at a high rate, bone is resorbed at a high rate after 70. Okay, so this is when we start to have collapse of the bone. What happens risk factor wise? We've all known an aunt, a grandmother, an uncle, someone that's had a hip fracture. Okay, or what's very common is a Colles fracture, meaning you fall with an outstretched arm and your wrist breaks, or you have a vertebral fracture or a spine fracture. We've all seen people that have that hunched over spine, and we've seen them in the office and we see them walking around, and I try to help those people. What happens is that's all vertical compression of bone. Okay, hip fracture, the mortality rate of hip fracture is basically 1 year. Usually people do not die from hip fracture alone, but the complications of it. Unfortunately, I know a lot of us know people that have had pneumonia a year after having a hip fracture, and it causes death. So again, something really important and very simple as calcium supplementation can prevent osteoporosis. So let's talk about calcium supplements. Calcium absolutely needs two things to be absorbed. One is hydrochloric acid. I just told you that when you get postmenopausal or postandropausal, what happens is the hydrochloric acid in your stomach goes down, so calcium does not get reabsorbed as well. Okay. The other thing that's very important that people don't know is calcium needs to be absorbed at night. It does not get absorbed in the morning. So you can take as many calcium pills as you want in the morning, but it's not going to do a thing for your bones. At night means 4 o'clock or after, and it gets best absorbed after meals. So I always tell patients to take calcium with room temperature water and take it at night. It's very important to also get a baseline. So bone density tests are covered by your insurance. Your primary care physician should be able to do at least one bone density test every 2 years for you. It's very important to get a baseline so we know how to supplement for calcium for you. Again, calcium gets absorbed at night. Calcium also needs vitamin C, vitamin D, hydrochloric acid, and boron to be absorbed. It is so imperative that people don't take cheap sources of calcium. Calcium carbonate is the cheapest source. Another medication called Fosamax, medications like that will basically, if you have lost bone or you already are osteoporotic, what it will do is prevent any more bone loss. What calcium does is rebuild bone. So hopefully you're not at the point where you need something like a Fosamax, but even so, calcium will help rebuild bone. It is important that we know your baseline. It is important that you follow up with your physicians, and it can be 100% preventable, so let's prevent it. Thanks.